Chair, this is Monica again. I know it's 1:01, but if we'd like to give it another minute, as currently only you and committee member Riley are currently on.
Sounds good.
Thank you. Good afternoon, everyone. This is Monica Schiffer with Nevada Health Authority. We're just allowing people to continue to join, and we'll be getting started shortly. Thank you. Chair, I'm going to leave it to your discretion. I see currently only you and committee member Riley are online as far as members go. I do know that Administrator Thompson and Administrator Jensen have been called due to special session today. I am unsure whether the rest of our members have also had to get called for that. So I do know that Administrator Jensen and Administrator Thompson both are not available due to special session. So we are pending committee members Washington and Gerolamic. It's 1:04 now, so I'll leave that up to you if you'd like to wait one more minute and get started, or if you want to go ahead and get started.
I think we can go ahead and get started, and maybe by the time we do roll, we'll see who is present at that time.
Okay, thank you.
All right, sounds good. All right. Good afternoon. On behalf of the Nevada Health Authority, Division of Nevada Medicaid, I'd like to call the meeting of the Medicaid Reinvestment Advisory Committee to order and verify that this meeting is being recorded. And today's meeting agenda for the MRAC was posted on November 5th, 2025 on dhcfp.nv.gov and at notice.nv.gov. And for roll call, I'll call the names. I understand that there's a few people that aren't with us, but just performative, I'll call the names. Administrator Ann Jensen. Fulala Riley. Fulala, are you there?
I see her on, Chair Sorensen, I see her online. I'm wondering if she's having difficulties. Committee member Riley, are you able to hear us? So she's on mute, but she is present.
Thank you. Erica Washington. Robert Thompson, who I understand is not able to be with us. And Haley Gerolamic. And Jonathan, I think I know the answer to this question, but have we met quorum?
Hi, Chair Sorensen. No, unfortunately, we have not met quorum.
Thank you, and we'll just keep monitoring to see if perhaps Haley and Committee Member Washington are able to join us. And conflicts of interest, agenda item number 3, please disclose any conflicts of interest you have at this time.
Is that for us? The
Hi,
members?
Falala.
Hi.
Hi, yes, this is Monica. Yes, just for committee members. Thank you.
Okay. I'm not exactly sure if these are, I have financial relationships as an organization with the MCOs. Is that something I need to disclose?
Yes, we appreciate, this is Monica, Chair Sorensen, with Nevada Health Authority. You can discuss that you have is that a working relationship? Is that what you mean by financial, or that you were part of the, okay. So I think that, yes, if that's great that you disclose that. I don't think that because we haven't met quorum, we won't be taking any action on anything today or anything of that nature. So I think that we're still okay to proceed.
Okay. So I have Help Southern Nevada has a housing contract, if you will, through the COC with Solar Summit, Anthem, and United Healthcare. And we have a relationship with CareSource that they support a FTE in workforce development for their members. I think that's it.
Thank you. So Chair Sorensen, I would say that because we're not taking any action, that we're still able to proceed on with the discussions.
Great. All right. Thank you. Agenda item number 4, if you would like to provide public comment, please raise your hand or type public comment in the chat and the last 4 digits of your phone number, and your name will be called on to begin. When you are called upon, please state your first and last name at the beginning for recording purposes, and you'll have 3 minutes to speak. And Jonathan, if you could please let me know if there are any comments or if we have anybody raising their hand, I'd appreciate it. It looks like we may have one.
Yes, Chair Sorensen. No comments in the chat right now, but Monica does have her hand raised. We'll let Monica go first, and then Andrea Gregg.
Thank you, Chair Sorensen. Monica Schiffer with Nevada Health Authority for the record. I know I said this before we started the meeting officially, but I just wanted to say that as a result of the governor calling a special legislative session that started today, the committee member, Nevada Medicaid Administrator Ann Jensen, and committee member, Division of Social Services Administrator Robert Thompson were not able to be here today due to those priorities coming up. I just wanted to make sure to let you and the other members know. Thank you.
Go ahead, Andrea.
Thank you, Jonathan. Good afternoon, Chair Sorensen and members of the committee. My name is Andrea Gregg, and I'm the CEO of High Sierra Area Health Education Center, also known as AHEC. And I'm here today specifically in response to agenda item number 9. AHECs have a longstanding history in Nevada addressing healthcare workforce shortages, particularly in rural and underserved communities. For over 2 decades, our network has aimed to recruit, train, and place healthcare professionals where they're needed most, improving access to care and advancing health equity. Across the state, AHECs work together. Desert Meadows AHEC serves Southern Nevada, Frontier AHEC serves Elko and rural communities, and High Sierra AHEC serves Northern Nevada, located here in Reno. And by collaborating, we ensure all regions benefit from workforce development and training programs. So as you're considering recommendations for Medicaid reinvestment, we'd like to ask that you consider prioritizing funding for the AHEC network here in Nevada, knowing that investing in AHECs ensure that the community's reinvestment dollars are really utilized to expand healthcare career pathways for students and emerging professionals. They provide continuing education and upskilling for frontline healthcare workers, and they promote culturally competent care and reduce disparities in healthcare access. And then I'd also be happy to serve as a resource for any MCOs to connect with AHECs across the state, really helping to ensure that these investments have the greatest impact statewide. Thank you for your time and your consideration.
Thank you, Ms. Gregg.
Chair Sorensen, this is Jonathan. No other comments in the chats, and I do not see any other hands raised.
Okay, great. Thank you. Agenda number 5 and 6 relative to minutes for December and June. I know that we're not able to take a vote on this. Do we proceed with discussion? Is that something we can do?
Yes, Chair, this is Monica with Nevada Health Authority. You can discuss and we can move these to the agenda item for the first meeting of next year if you'd like.
And I see that the December minutes were emailed just a bit ago. I believe the June minutes were provided previously, so I don't know if there's been an opportunity for people to review the December minutes, but open to any comments or discussion on the June or the December 2024 minutes. It doesn't look like there's any discussion at this time, so those then will be held over to our next meeting agenda. And item number 7, review bylaws. Monica, did you want to discuss the bylaws?
I wanted to take an opportunity, and actually I will send these out again closer to the, I'm sorry, Monica Schiffer, Nevada Health Authority. I wanted to take an opportunity for the members to take a look at the bylaws because of the split as a result of the 83rd session, legislative session this year. The Department of Health and Human Services was split into the Nevada Health Authority and the Division of Social Services. And the Division of Healthcare Finance and Policy was renamed to just Nevada Medicaid Division. And so as a result of that, we would probably want to update the bylaws to change the information from Division of Healthcare Finance and Policy to the new name, and thought you folks might want an opportunity to look at the bylaws also. And if there's anything else, we aren't able to take action on them today, but Jonathan, if you have the opportunity to share the bylaws with the proposed markups on there, then we can send it out prior to the next meeting for any further discussion, as I know we don't have all of the members here today. And so happy to do that, but just based on the information that we do have available, the only updates that I was going to suggest, Chair Sorensen, was the update to the name of the DHCFP to Nevada Health Authority.
And I have no comments at this time regarding the bylaws. I've had a chance to look over them.
Okay. Member Riley, it looks like you came off mute. Did you want to say something?
No, did I miss us getting the bylaws, or you're saying that you're going to send them out?
So, Jonathan, I'm not sure if you're trying to share them. I don't see them. I'm going to send them out prior to the next meeting. Because I do have to give you folks sufficient time to look at them and make suggestions, but I wanted to just bring it to you folks today to let you know that we do have an opportunity to update the name. And if there's anything in the bylaws that you folks wanted to discuss or have me also make any adjustments to before I send it out to the full committee for our next meeting on potentially action items. So.
Okay, thank
Just
you.
discussion today. Thank you.
And agenda item number 8, the review of the annual report. And the report was distributed. And I'd open the floor to any discussion or feedback regarding MRAC's annual report. I can make just a few comments. You know, the reinvestment funds have been used to address efforts related to homelessness, disparities, and social determinants of health. And we can see in the report how in those categories the funds have been reinvested. And so I think these are important priorities that are reflected in this report in terms of housing, supports, and services, maternal and infant health, social determinants of health. And then there's a category of others that don't fall cleanly into any of those previous categories. Things such as UNR psychiatric residency program, direct employment training for individuals experiencing homelessness, funding to upgrade medical equipment at the Phelan Tribal Health Center, and various family engagement events throughout the state. So in terms of where the investments have been as reflected in this report, I think this continues to be these continue to be areas of priorities, and pleased to see the work that's been done and reflected in this report. Any additional feedback on the report?
None here. Looks pretty comprehensive.
If there's no additional discussion on the review of the annual report, then we can move to agenda item number 9, suggestions for next year's reinvestment. And we did hear from Ms. Gregg with regard to the AHEC network and the focus on workforce development. And I don't know that we, in terms of our recommendations, name specific agencies rather than more kind of categories of prioritized investments. And so workforce development, I think, remains a high priority given the factors related to inflation, unemployment, increase in expenses, related to rent, especially at the lower levels, food, healthcare, transportation, and so on. So workforce development, I think, remains a priority. Another priority I would just highlight, and this is in the area of housing supports and services. People may not be aware, but there is a notice of funding opportunity that we have been waiting for our community of care COC funding. And what we have done in Southern Nevada with a large portion of that funding is invest in permanent supportive housing. And we believe as this new NOFO, as it's called, is dropped and we have an opportunity to review it, that the funds will not be permitted to be used for permanent supportive housing. And so I would just like to call out in the housing and supports area that an investment in permanent supportive housing is a priority. It's an important part of our housing continuum as we move people from experiencing homelessness to more permanent living situations. And there are many people who need kind of continued support to maintain housing. And so just calling out permanent supportive housing, and that could be a need that is an increased priority for us moving forward.
Fulala Riley, I would just like to echo that for what Jamie just discussed. It seems like because of the new NOFO coming out, there'll be a whole segment of our continuum of housing that will be eliminated, if you will. But it's an extremely important part of bringing people indoors and sustaining them. And so I would strongly support that we make an effort to support the permanent supportive housing type of programming, along with everything else.
Another area of priority that I would maybe highlight that I don't necessarily see reflected in this last report, there is a category of maternal and infant health. But I think increasingly in specific zip codes in Southern Nevada anyway, we see preventable undesirable outcomes in terms of infant mortality and morbidity, reflective of pregnant women not having access to contiguous prenatal care, and absence of STD testing, which is resulting in catastrophic impacts on newborns, and the effects of also substance abuse. And so I think in that area of maternal and infant health, calling out specifically access to prenatal care for those who are struggling to obtain consistent access, at least those monthly visits. Committee Member Riley, any other areas of priorities you'd like to identify or call out?
I would like to keep all the priorities from last year, just with a highlight on particularly the areas that the federal funding is going to eliminate a great deal of it. So that's I would like to do that, like maternal group health, maternal health. I'm in support of that. The only funding that we have available to us is for younger people. So it doesn't, there's not a lot, and there's not a lot of beds in our community, at least here in Southern Nevada. There's some on the horizon coming forward, but as a community, we're sorely lacking in those. So of course I'd support that as well. Particularly because I think we go up to 21, right? But there's some infant mortality obviously going on with women that are older than that. So I would support that as well.
And I'll also just highlight, I think I maybe already called this out, but the importance of priorities related to workforce development. Any other comments on next year's reinvestments?
The only comment I have is about workforce development. If we could perhaps look at, like DETR and, our local workforce connections board. So that maybe if, as they're doing those investments, that they're in conjunction with and adding to, and then perhaps maybe even paying attention to, are the workforce development going to be the federal funding? Are they affected as much as permanent supportive housing? And because there might still be availability of funding those in a through a different mechanism or the current mechanism. I would just like to really pay attention to where we are literally getting cut to zero. Perhaps Medicaid reinvestments could focus on those.
I appreciate that comment. I think, agencies, providers are trying to assess and monitor what's happening on the federal level in terms of executive orders, policy decisions, funding priorities, and where the use of funds are prohibited from services that have traditionally been funded with federal funds. And so because it seems to be a moving target, I think it would be helpful for there to be some continued discussion around those moving targets and where we are finding ourselves with gaps in services that have traditionally been funded by federal dollars. And so I'm not sure how to wrap that into, recommendations for this next cycle, but there may be a requirement for continued dialogue around funding priorities that are emerging because of executive orders, policy decisions on the federal level, and changes in federal funding priorities. Agenda item number 11, meeting dates for 2026. Monica or Jonathan, do we have proposed dates? I think we maybe identified some that perhaps wouldn't work, but and I don't know if this is an item that requires a quorum, but how would you like to proceed with meeting dates?
This is Monica. Would you like to keep the meeting cadence at twice next year? Because if so, what I can do is Jonathan can send out a poll for maybe a spring date and a fall date. Send a poll out to the members. With sometimes I think he does have has your availability where that doesn't work. And then he could send out a poll for a spring date and a fall date if that is something that is agreeable to you.
I think that works. I don't know if we are going through this next cycle, and we have emerging information relating to changes in funding for items that we believe to be priorities. Is there the option to add a meeting to further discuss prioritization of where these dollars are focused?
Chair, this is Monica Schiffer with Nevada Health Authority again. Yes, if you determine that you would like to add a meeting, you can. If you prefer to just get 3 on the calendar now, we can also do that. If that's your preference, we can help support you either way. And if you would like to do 3, we could do an early spring, a midsummer, and a fall if you'd like to do that. Or we can do the spring and fall with call of the chair if there's an additional meeting you'd like to set.
I recommend the spring and fall as we have historically scheduled, and should we have specific agenda items or issues that we'd like to discuss, to call an additional meeting with an explicit focus on those items.
Okay, so I'll, Jonathan, this is Monica Schiffer. Jonathan will send out a poll for those dates for you folks.
Agenda item number, yeah, thank you. Agenda item number 12, public comment again. If you'd like to provide public comment, please raise your hand or type public comment in the chat, and the last 4 digits of your phone number and your name will be called on to begin. Again, please state your first name and your last name at the beginning for recording purposes, and you have 3 minutes to speak. It looks like we maybe don't have any public comment.
Hi, Chair Sorensen. This is Jonathan. There are also no comments in the chat.
All right. So agenda item number 13 is adjournment. Thanks for joining us this afternoon. I know that there are a number of things going on and some of the committee members weren't available this afternoon, and we can carry items that we weren't able to address today to the next meeting when we have a quorum. So with that, I hope people enjoy the rest of your Thursday, and thanks for joining us this afternoon. And for Jonathan, Monica, and team, thanks for pulling us together and all of the supporting documents and planning for this meeting. I appreciate it.
Thank you, Chair. Thank you all.
Thank you.